Hi and welcome. This is Dr. Javier Sevilla, and I'm going to talk about the 2-week visit today. So, why don't we start with you, Mom? Let's start with the most important thing, which is how well you are. Just like the announcement in the airliner, um, put the mask on you first and then your child. This is a critical time for the baby, and we are going to focus on you first to make sure that you're doing okay at the moment during these stressful 2 weeks of having a baby. So, the first thing to focus on is getting rest. And I know this is very difficult when you're probably not sleeping more than an hour or two at a time. But it's very important that you try to sleep when the baby sleeps. So take advantage of the time when the baby's sleeping and just try to get some sleep at that point. Have other people, some of your friends, maybe daddy or other people in the house help with the chores. Your job is really to attend to the baby and to attend to yourself. So make sure that you're getting enough to eat. If you're breastfeeding, make sure that you're getting a lot to drink, okay, especially water, and make sure that you rest as much as possible. It's pretty normal to feel tired, overwhelmed, and very stressed at this point. I would say this is probably the hardest part of being a parent is those few weeks after the baby's born. Now, it is pretty normal for the first week or so to have what's known as the baby blues. And that is, kind of a feeling of depression or so. You feel very sad, you cry easily. And that should be gone by about this time, by about 2 weeks. If you're still having those feelings of sadness, where you cry a lot, you don't enjoy anything, um, please let your provider know, let me know as soon as possible, because that could be something else, and it could be postpartum depression, which will actually start coming after 2 or 3 weeks that the baby's born. All right, let's focus on the other children. If you do have other kids in the home, um, they're going to be saying, what's going on here with my new brother or sister? So it's important for you, Mom, to dedicate at least some time of the day to them. What I would recommend is that you do a 1 hour every day with the other sibling or siblings. And you call it mommy time, and you have 100% attention on those other siblings. And this will actually prevent any of the issues that happen with sibling rivalry and jealousy of the baby, especially if you have younger brothers and sisters. All right, let's focus on the baby now. So the biggest thing with the baby is the transition. So the baby was inside the womb, no light, getting basically fed the whole time, and no real routine. There was no difference between day or night in there. And now that the baby's here with us, we're going to try to introduce some routine and some structure. Um, let's start with sleeping. So normally a baby should sleep about 18 hours of the day. Um, so pretty much most of the day the baby's going to be asleep, except the baby's going to wake up to feed, and maybe a few minutes before feeding and a few minutes after feeding, but pretty much the baby's going to be asleep. Um, However, the baby's not going to know day or night. And so this is when you can actually start setting the time of night and the time of day for the baby. Some of the ways that you can do that is through natural light. So I would advise you to maybe keep the lights on, keep the curtains open, the blinds open, during the day, so the light gets into into the place where the baby is. And at night, kind of do the opposite. So even if the baby's waking up at night, try to keep the light as little as possible, so that the baby's brain starts seeing the difference between day and night. The other thing that helps with the day and night transition is a structured feeding schedule. So I would say it's important for you to feed the baby at pretty much regular intervals and as close as possible from the previous day, so that you have a schedule for the baby. One of the things that we see is babies that are on a schedule and that have that structure tend to sleep much better, when they get a little bit older. Something else about sleeping. So we all know the safest way to have a baby sleep is on the baby's back. So we know that that prevents sudden infant death syndrome, and it's a good idea to put the baby on his or her back, and make sure that there's no soft toys, pillows, blankets, or anything soft in the crib for the baby. Let's talk about co-sleeping right now. Co-sleeping is a big cultural tradition in lots of different cultures, and certainly in the Hispanic community it's very popular. The co-sleeping part is not an issue. The biggest issue is that adult mattresses, the mattresses that we have in our beds, are not designed for babies, so they're usually too soft for a baby. So that's why we usually recommend you to have the baby maybe in your room, but the baby should really sleep in its own crib. Again, because the adult mattresses are not designed for babies. In terms of the baby's crib, it should have a firm mattress, and there shouldn't be much of a gap between the walls of the crib and the mattress. As we said again, you want to avoid any pillows, blankets, soft bump pads, or soft toys in there for safety. All right, let's talk about feeding. That's another very big issue right now at 2 weeks. So if you're breastfeeding, you should pretty much be getting into a rhythm by 2 weeks, and your milk supply should be there pretty regular by now, by 2 weeks of age. How do you know if the baby's getting enough milk at this point? Well, for breastfeeding babies, the best way to look is to look at the amount of wet diapers that they have. So by now, we would say about 5 or 6 wet diapers. And in terms of poopy diapers, sometimes breastfed kids have a lot of poopy diapers, but I would say between 4, 5 to 6 poopy diapers would be normal for this age. The poop should look like yellow mustard with little white seeds. That's a normal breastfeeding poop, and there should not be any blood in it, and it should not, again, have mucus or anything like that in the poop. What are the signs that the baby's hungry? So one of the things that you'll learn when you're looking at your baby is that crying is actually a pretty late sign. So there's lots of things that the baby will do before crying. So the baby will be putting his or her hand around her mouth. They'll be, sucking. They'll be rooting, and there'll be some facial grimacing. After that, the baby will start getting fussy, and then ultimately the baby will start crying. But if you pick up those cues, right at the beginning, then it'll be a lot easier for the baby to calm down and latch on to the breast. How often should a baby be breastfeeding at this point? Usually during the day, every 2 to 3 hours. And you know, it's okay if the baby goes for about 3 hours at night, but you probably don't want the baby to go a little bit longer than that at this point at about 2 weeks of age. Um, if your baby is formula fed, you should expect to be feeding the baby about 2 ounces every 2 to 3 hours. So the baby should be getting maybe about 20 ounces um, in the day for the whole 24 hours. And again, if you do it regularly like that, you should be fine. Formula fed babies can go a little bit longer, so you would see probably 3 to 4 hours between feedings as opposed to 2 to 3 hours with breastfed babies. All right, let's talk about something else. Let's talk about some safety issues here. So what do you do when you want to transport the baby somewhere? So you want to put the baby on a rear-facing car seat and on the back seat. Okay, you want to make sure that those harnesses are pretty snug, that they're not really tight, but they're snug. And you want to make sure that the baby's head is not, you know, going forward like that. You want to angle the car seat so that the baby's head is not falling forward. If the baby gets fussy when you're going in the car, stop the car and park in a safe place, and you can take the baby out, calm the baby down, and then you can put the baby back in the car seat and make sure that the baby is buckled in the car seat before you start the car again. You don't want to take the baby out while somebody's driving, while the car is in motion. When should you call the pediatrician? When should you call me at this point? Well, there's definitely a few things that I would say you definitely need to call me anytime, whatever time of the day or night. So one of them is a fever. And the way that we would advise you to take the temperature on a baby this age is through using a rectal thermometer. So even though you probably got lots of ear thermometers, you know, in the baby shower, those are probably not going to work right now. They're very good for older kids, about 4 years old and older, but really for a newborn, you really want a rectal thermometer. What's considered a fever? Fever is considered 100.4 or higher, and that's again a rectal temperature. If that happens, you need to call me right away. When should you take the temperature? Should you be checking the temperature every day? I don't think that's necessary. I think the things where I would recommend, or the occasions that I would recommend that you check the temperature is A, if the baby is very fussy and you can't figure out why. You changed the baby, you fed the baby continues to be very fussy. If the baby feels very, very warm, or if the baby is very lethargic. So any of those things, definitely check the temperature and let me know. When should you, when is it safe to take the baby out? Well, I would say there's several factors here. So the immune system of the baby is still pretty immature. So you want to avoid crowded places. You want to avoid places where lots of people are going to be handling the baby. You want to avoid places where lots of people may be sick. So I would probably keep the baby away from crowds at this point, at least through those first couple of months. In terms of the sun, taking the baby outside, you know, to the garden, to the yard, the baby's skin is very, very sensitive. It's only about 1/10 of the skin of an adult, and so the baby can get sunburned pretty quickly and pretty easily. So I would recommend that if you do take the baby, you make sure that you cover the baby And the best way to protect the baby from the sun is clothes. So make sure the baby's covered with clothes, and that will protect from the sun. And you want to avoid direct exposure to the sun, but by all means, it's absolutely fine to take the baby out of the house at this point. There's no problem with that. Other safety issues, so by now the belly button probably would have fallen off, and so you're fine to bathe the baby. Now for bathing, a couple of quick safety tips. So number one is you want to feel that water on your wrist before you put the baby in there. And something that you can do, which is actually very useful for the rest of the baby's life, is change the thermostat on your water heater to a maximum of 120 degrees Fahrenheit. So 120 degrees Fahrenheit, you know, as an adult, you won't feel any difference. You won't feel that it's colder. However, if for whatever reason you get that water, that hot water on a baby, the skin will actually take a considerable amount of time until it burns. But at 130 or 140, that will be seconds before the skin burns. So that's something very simple that you can do, you know, in preventing any burns in the future. So those are some of the highlights for the 2-week visit. The next visit with me will be at 1 month of age, and we'll talk about other topics at that point. So if you have any questions, feel free to email me or call the office.